So hopefully that gave you a sense of how to perform ventilations, and you saw how we do it in the healthcare setting. I want to show you now a real case of cardiac arrest recorded using a specialized defibrillator that records both ventilations and compressions. The reason why I show you this is we're going to use this as the basis for some of the data I will share with you about the quality of CPR as performed by healthcare providers. And I think you'll find this very intriguing. So this is an actual cardiac arrest, and in the top tracing, those little red humps represent breaths being delivered by a rescuer. In the middle is the ECG, or electrocardiogram, or electrical recording of the heart. And in the bottom tracing are compressions. Each vertical line there represents an individual compression. The depth of each of those little valleys represents the depth of each compression. So now let's roll the tape. So this is a patient in cardiac arrest. They're receiving compressions and breaths, and then the team stops compressions. And they do that because they have to, because they want to look at the ECG to decide if this rhythm needs a defibrillation, a shock. And you'll remember from our first lecture, we talked about shockable and non-shockable rhythms, that some cardiac arrests need a shock and some do not. Well, I'll just tell you that this one did, because this rhythm is ventricular fibrillation, or VFib for short. So the rescuers quickly move on to deliver a shock, and those little blue lines and notations in the top tracing shows the shock being delivered. And now you notice that the rhythm has changed. Those of you who are not healthcare providers can probably see that that middle tracing does look different now. Healthcare providers, you may be guessing what's going on. And indeed, compressions are once again started because the team recognizes now ventricular tachycardia, or VTach, another cardiac arrest rhythm. Now I only show you this as an example. This was an actual real cardiac arrest that we participated in, and it shows you the sort of data you can obtain if you record ventilations and compressions. We used a tool like this to study CPR in the hospital to ask some fundamental questions about quality. And what I want to share with you now are some results from our research group looking at healthcare providers, doctors and nurses, providing CPR in the hospital. And this is going to be what's called a frequency histogram, or said another way, the distribution of chest compression rates in a series of cardiac arrests.